Good afternoon, and thank you very much for joining us today on the program Healthy Living. I am Adesuwa Usawagie. So far, we have 12,486 cases of coronavirus in Nigeria. 3,959 have been discharged, and we have 354 deaths in Nigeria. And we're sincerely hoping that these figures will stop going up every day. Although new cases are being discovered every day, but we're just hoping that at some point, this is going to stop and this is going to end. But if it doesn't come to an end, we just have to do our best possible to live with it and make sure that if you have it, don't spread it. Okay, if you're having signs and symptoms, run to the hospital. The number to reach the NCDC with is everywhere. Okay, just do your best possible to make sure that the coronavirus pandemic is curtailed. Churches have resumed yesterday, and a lot of persons didn't go. Some went to see how the churches are coping and keeping with the laid down rules of gathering. And our news crew went around town yesterday and discovered that some churches, or most of the churches, did wonderfully well. But that's not enough. We have to do more. We have to do more to curtail the spread of coronavirus. For those who still believe that coronavirus is a fluke, then you have something huge coming to hit you without knowing, okay? So coronavirus is real. Let's practice social distancing, and that is one area that we are truly failing, social distancing. If we can do that and, you know, exercise other precautionary measures, I'm sure we're going to be very fine. Quite unfortunate also that there is a high rate of rape in our society today, and we truly don't know where this is going to lead us to. But all hands are on deck to make sure that this is curtailed, nipped in the bud, in fact eradicated, because no woman should suffer rape. We also understand that few men do suffer rape too, but how that happens is well, we'll leave that to the doctors to tell us how that happens. But today we want to look at infections, vis-a-vis infectious diseases that causes infertility in men. Infections and infectious diseases that causes infertility in men. We'll take a very short break, and when we come back, we'll be talking to Dr. Steve Ogboma. We'll take that short break now. All right, thank you very much for staying with us. Today we're looking at infection, vis-a-vis infectious diseases that causes infertility in men. And we're going to be speaking with an expert, Dr. Steve Ogboma, Chief Medical Director of Gable End Specialist Hospital, Enya, here in Benin City. Dr. Steve, it's been a while. Happy to have you on the program.
Thank you very much.
Okay. So we're looking at infection, vis-a-vis infectious diseases that causes infertility in men. So let's start with infertility in men, and then we'll take it from the infections that can actually cause it, and then the types.
All right. Well, infertility is about 40% from the female side and about 40% from the male side. And the last 20% is a combination.
Okay.
And just a small percentage of them is unknown, where all investigations have been done and the cause has not been found, but there is infertility. Theoretically, if you have 100 women, you know, who are trying for a pregnancy over a period of 12 calendar months, only 84% of them will achieve a pregnancy. 16% of them will not achieve a pregnancy, not that they have any pathology. All right, but dealing with infection, infectious diseases in men. Infection per se is whenever a pathogen, a microorganism, gets into a being and multiplies and creates infection. And the sum total of infection is the entry of a microorganism into another body, or a human being, can be an animal, or even a vertebrate, whatever, any living thing. It multiplies, and the body of that organism, of that human being, reacts to it. The sum total of these three phenomena is what is referred to as infection. So there are effective agents that are associated with male infertility. The commonest one many years ago was syphilis. However, the incidence has come down, and in places in this country, it's difficult to make a diagnosis of syphilis, and it's very, very rare at the moment. But in the riverine area, well, places along the coast, places where you have high level of hoteling, you have high incidence of syphilis. It's not only syphilis, you have Neisseria gonorrhea. Neisseria gonorrhea is another common cause. Then there is, but Neisseria gonorrhea is associated with problems, with dysuria and discomfort. But there are pathogens that create serious, injury to the male and the female as well, without showing any symptoms. A typical example is Chlamydia trachomatis. Okay. And another typical example that is completely innocuous. It does not cause pain, it does not cause any discomfort. But the only sign of it is it has a fishy odor. That's bacterial vaginosis. It's caused by molluscus. This is very, very common. Okay. It's associated with a change in the pH, especially in the female genital tract, from being acidic to being alkaline. Okay. So all these are associated with male infertility. Neisseria gonorrhea, in particular, interferes with the urethral tract, causes constriction and fibrosis of the urethra, and it can affect the orchids, that testicles, and interfere with their ability to produce spermatozoa. So without spermatozoa, fertilization cannot take place because they carry, 23 of the garments, and the female carry 23 of the garments, to create.
Although you said that some of these infections do not show symptoms, yes, and do not show signs, it's just there. How would a carrier know?
No, in most cases, they don't know. But a woman who is very fastidious, who looks after herself, a woman who knows when there is discharge from the vagina, then will be able to know.
But the man would not know.
No, because the discharge from the male is minimum, but the discharge for the female is more obvious because it's rather copious in the mouth. But in the male, is very minimum discharge when they have something like bacterial vaginosis, or if they have syphilis or gonorrhea in particular. Gonorrhea produces very purulent discharge from the penile shaft and from the female as well. So both of them produces symptoms. They are associated with dysuria, that difficulty with maturation, with passing urine. So this happens, and on knowing this, they will seek the advice of a physician.
Okay, let's talk about penile genital warts. How is it like?
Yeah, well, penile genital warts occur in both male and female.
Okay.
All right. In the case of the female, it occurs on the labia minora, labia majora, and it can ascend to the level of the clitoris. It can progress backwards to the perianal region. Yes. So you can have it in all these areas. It can cause a lot of discomfort, a lot of pain, especially those who are into same-sex relationship. They get it quite often. But in the case of the male, it's on the penile shaft. So when you have warts, it's very painful, it's itchy, causes a lot. Yeah, it's painful. It's painful, it's itchy, it causes a lot of discomfort. So we usually treat it with the common anti-wart agent. You know, warts, there are many types of warts.
Okay.
The types of warts are over 90 types of warts. So you can find warts in the soil, you can find warts in the swimming pool.
So you can pick it anywhere?
Yeah, you can pick it. You know, even you can see little children who don't know anything about sex, they can grow warts on the sole of their feet, where you have to take it out and burn it. So wart is a very, very common disease. The thing is that when men have warts, they do not seek medical advice. They try to do the treatment.
The DIY.
Yeah, they want to do DIY with treatment. So because there is delay, then these warts, especially with healthy men or with diabetic men, they grow luxuriantly. They now cover and make the penile organ very, very unsightly. So in that situation, it may not be possible to deal with it medically. You have to apply surgery by putting them to sleep and burning the warts under general anesthesia. You know, you just use laser, laser to burn it and burn all of it. So the skin will regrow. When it's very bad, you know, they have to replace the skin. So warts is common. It can be found anywhere and is sexually transmitted.
So they have to be very careful.
Yes.
Now, what other early symptoms or signs should a man look out for?
Pain, unusual pain, itch, you know, and growth of these little warts. At the beginning, you know, they're just speckles on the penile shaft.
And must be taken serious.
Yes, but most of the time, it's not taken serious. So they are likely to grow, yes, and they are likely to deteriorate, and they have to seek serious medical advice. Yes. At the very beginning, there are some ointment you can put that will burn it if they are small. But when they become extensive, then you require surgical management. Yes.
Okay, apart from sex, are there other ways they can be transmitted or gotten?
Yeah, I just mentioned somebody. Children can pick it up from the soil, from walking barefooted in the swimming pool. You know,
there's this one that people talk about. Once they have any infection, the next thing is toilet disease. Oh, they got it from the toilet. Is it possible to get any of such infections from the toilet?
You can pick warts from the toilet, a general toilet. You can pick warts from general toilet. If you observe that, in most airports, in the international airports, they now have sanitizers, you know, on the toilet seats. And secondly, they have this shifting polythene on the toilet sheet. So when you finish and you flush, the polythene moves. Your own goes into the shredding bin, and another portion, you know, covers it spontaneously. It's a non-touch technique. Nobody touches anything. It's the machine that moves it. It's quite, you know, protective.
That's in the international community. Yes, but we're looking at our community here.
Oh, well, it's cleaning it. They should clean. They should make sure they clean. Use antiseptic to wipe the toilet seats after use. And before you leave, after going to the toilet, you should keep it clean for the next person. So less job for the next person. So if we keep it clean after we've used the toilet, then the next person is unlikely, very unlikely.
Okay, so all of these infections that we've mentioned, how does it really trouble a man when it comes to procreation?
Well, a man with warts, for example, cannot have a comfortable sexual relationship because it's painful, you know. Yeah, it's painful. It's associated with the itching. There's a lot of discomfort. And
is there any injury?
No, there's no injury because it's fleshy. It's fleshy tissue. It's the same color of the skin. You know, for a black person, it's black. For a white male, is the color of is pink in color. So that's how it is. You cannot, it can interfere with relationship because it's unsightly. And males that have it because of shame, you know, we want to disclose it. So they self-isolate themselves from having a relationship, especially with those they care about.
Okay. Yeah. So they just hide.
They hide it, yeah.
So just talk to us a little bit about the dangers of trying to like self-medicate, because usually people don't like hospital, particularly this period. Now, where everybody's afraid of the coronavirus thing. I remember going to the hospital for the week and I was like, you know, everything was so irritating and, you know, that kind of feeling.
Yeah, it's
people
scary.
don't want to go
It's
to
scary
the hospital.
going to the hospital.
Yes. Naturally, men don't like going to the hospital, not to talk of now.
Yeah, now when you see everybody masked, everybody gloves, with protective equipment on, you feel strange.
And the issue of, you know,
and
shame and all of that.
Oh, well, you see, there's a proverb in Benin that when you are ashamed of a disease, then it might draw you closer to the grave. So the thing is not to be ashamed. The thing is to seek the advice of a competent physician, you know, who will look after you and relate it. And relate it to your spouse. Your spouse will be the person who will ginger you and make sure you seek medical advice. Yes. That's how. That's the way.
How easy would it be for a man to like discuss such a thing with the wife?
That's the appropriate thing that should be done. It's difficult.
It's appropriate, but how easy would it be?
I think it's very easy. If you're the kind of man that doesn't keep secret, I don't have any secret. Everything is in the open there. If you enter where I live, you can, everything about me is there. So people are like that. The men should behave 100% open to their wives. So that if there's a problem, it's your wife, it's your closest person, it's the second you. They say the white man calls it the better half of you. So why can you hide something from your
half from the white man, yeah?
Yeah.
What does the black man call
No, it's still the same
house?
thing. It's unfortunate, but we are moving, we are making progress on a daily basis. So we will get there at some point.
The issue of infidelity will not allow a lot of persons to open up to their spouses. So,
okay, yeah,
so that's what I'm asking. Right. How is that man going to like discuss it?
But do you know that it's men who are engaging in infidelity that should talk more with their partners so as to resolve issues? You don't hide. When there's a problem, a medical problem, you should not conceal it. You should expose it. Then you will seek advice and they will deal with it and prevent you from, you know, dying in the process or losing your ability to procreate, because that's very important. The Bible says go into the world and multiply.
Okay.
If you lack that ability, then there's a problem. That's what it is. So men should be open to their wives and let them know so that they can take part in the decision-making process when there is a problem. Okay.
All right, let's look at, you know, diagnosis. You just have to be in a hospital. You cannot self-diagnose.
Yeah, you can. Well, for an intelligent person who has seen warts before, maybe seen wart in the bottom of a child or around the anal margin of a child, we know what warts is. It's a normal growth, fleshy skin. And they can't miss it. When suddenly your skin that has been smooth suddenly has some irregularity as a result of fleshy growth, you will know. So men will know there is a problem, and like I told you, I said it can be very itchy, and secondly, it can be associated with discomfort. So sexuality is reduced at this time, either as a result of shame or as a result of discomfort. I agree with you. People don't like to disclose such things, but it's best. My advice is that they should disclose and have it treated, have it looked after and dealt with as soon as it's practicable. Yes, because you can't transfer. It's a sexually transmittable disease because it can be transferred from the male to the female partner. And in the female, it's more difficult. And knowing that if there's a pregnancy, the baby is going to pass through the natural passage, and the baby can pick it. Baby picks it, it gets into the baby's oropharynx, and that's a serious problem for the baby. So the thing is to make sure whenever it's detected or you think there might be warts, is to have it treated as soon as it's practicable. When the male treats himself, the female should be examined to make sure if there's any upcoming infestation, then it's quickly dealt with.
Okay. All right, let's look at this one that people talk about in their, you know, when you see 2 or 3 guys talking about infection, the next thing that comes out is Staphylococcus.
Staphylococcus.
You know, you begin to wonder, big name and stuff, and, you know, they're kind of panicky about it. Is it something a man should worry about?
Yes, I think everybody should worry about Staphylococcus. But the unfortunate thing is that Staphylococcus is everywhere.
Everywhere.
Everywhere. It's on the skin, the mouth, in the eyes, in the back passage. Staphylococcus is everywhere. But if that individual is healthy, his immune status is normal, then there's nothing to worry about because you are producing similar bacteria that keeps the other abnormal bacteria in balance.
Okay.
So it does not overwhelm it. But a situation where the immunity of somebody drops, either as a result of infection, like a human immunodeficiency virus infection, or as a result of poverty, as a result of other diseases like diabetes, mellitus, then the immune status drops. And in that case, Staphylococcus that normally will inhabit the skin without creating problems starts creating problems. So it can end up with infection of the vagina, infection of the cervix, cervical os, and it can deteriorate and affect other organs, especially in the female genital tract. So if the woman has a reduced immune status, such a woman should, as much as possible, avoid a relationship with anybody known to be a carrier. Like I said, Staphylococcus is everywhere. They do not become a pathogen to create problems so long as the individual is healthy and the immune status is normal.
All right, Dr.
There are other diseases in the same group, like beta hemolytic streps. Beta hemolytic strep can be in the male, and it can also be in the female. This is a deadly disease because for the female, it can cause recurrent miscarriages. It can cause delayed preterm labor. It can cause miscarriage. Okay. So all these various types of problems.
Doctor, can you call the name of that disease again?
Beta hemolytic streptococcus.
Okay.
Yeah.
All right, that's good. All right, moving on, doctor. We would like to, talk about treatment a bit, but let me quickly open the lines. 052290573. 052290573 is the number to call us with. You can start calling in now. The number is going to appear on your screen shortly. 052290573. I think you should call Dr. Steve Ogboma. And if you're a little bit shy, you don't want to call, you can ask your wife to call for you or your partner, but educate that partner very well on exactly what your problem is, okay, so that the person will be able to transmit the question to the doctor. Transmit, I don't mean it the other way, okay? At least let the doctor know what you are going through. Okay, give the doctor a call and you will be happy you did, okay? When you're calling, reduce the audio level on your television set or move away from where your TV is and then talk so that the doctor will be able to hear you and prefer a solution. 052290573. Doctor, let us look at treatment generally for this kind of problems in men.
Yeah. Okay. Well, the treatment depends on the causative organs.
Okay.
We've mentioned various causes of these male infections in the genital tract. For example, warts. You have to treat it with the appropriate...
Okay, doctor, just hold on. Hello, caller, good afternoon. Hello?
Hello?
Yeah, good afternoon.
Yeah, good afternoon, ma.
Please tell us your name and ask your question.
My name is...
What is your name, please? Hello? Okay, don't be shy now. Just call us and ask your question, okay? Hello, good afternoon. Hello? Hello? Okay, 052290573 is the number to call. Just give the doctor a call, okay? I just want you to have 30 minutes of... Hello, good afternoon.
Hello.
Good afternoon.
Good afternoon.
Good afternoon. Tell us your name and ask your question straight up.
Please, my name is Apostle John.
All right, Apostle John, go ahead with your question.
Please, what I want to, my own case is not an infection. I have a stomach ulcer for more than 2 years now. How possible can I treat it?
Stomach ulcer.
Yeah.
Okay, I think you should go to the hospital because what we're dealing with today is infection and infectious diseases that can hinder a man from procreating. All right, so when you want to ask questions, please ask questions relating to what we're talking about today. Hello, caller, good afternoon.
Hello.
Hello, good afternoon. Please tell us your name.
Hello.
Hello, tell us your name. All right, I did say that you should move away from where your television set is or reduce the audio level. That is, kill the volume, come on the volume, totally. Okay, hello? Yeah, good afternoon. Hello, good afternoon. Okay, the lines are jamming. So the moment you say hello, just go straight up to your question, okay? Because before we go to other formalities, somebody else's call will just cut your line off, okay? Hello, good afternoon. Hello? I can actually hear myself. Okay, call us on 052-290-573. Dr. Steve Ogboma is a specialist in that field, and it's going to give you all the answers that you want. Hello, caller. Okay, Doc, let's continue with the treatment. What's the possible treatment for such infections?
Well,
If we can take it one after the other, maybe the popular ones like gonorrhea, the genital herpes, the hepatitis, syphilis, and all of that. You know, treatments, I'm sure the treatments are not the same.
no, definitely, the treatment are not the same. But I think to avoid self-medication, it will not be appropriate for me to outline the various treatment.
No, we don't have to talk about the drugs.
Okay.
At least the processes.
Yeah.
And how long it takes.
Okay. For example, if you have warts, there are liquids you can put on the penile shaft, and it will dry it up, and over time you get healed. Okay. In the case of Staphylococcus aureus, which I said is ubiquitous, you can use some antibiotics. But my advice is that they may be resistant to some antibiotics because they may have acquired immunity. Our people tend to do self-medication. They do not take adequate amount of the antibiotics, or they do not take the antibiotics for the appropriate duration. So the bacterial organisms, develop immunity to these various antibacterial agents. So my advice is to ensure a sample of the discharge is taken and sent to the lab for culture. On the basis of culture, they will determine the sensitivity, of the pathogen to a particular antimicrobial agent. And such antimicrobial agent will be prescribed by the physician. In that case, you are sure of hitting directly, the pathogen on the head, and that will completely eliminate it. But for you to just go to the chemist shop,
which is usually
capsule,
what plays out most times,
and buy capsule for 2 or 3 days, and you feel better and think you are well. No, that is the wrong approach. Ensure that the nature of the pathogen is determined by culture, and they do the sensitivity to determine the nature of the antimicrobial agent that is suitable for that bacterial organism. Then you see a physician who will tell you, take such and such amount for this length of time. They may treat you for 5 days or 7 days or 14 days. Generally, we treat all these cases. But there are all these organisms we have mentioned that you can treat for up to 3 months before you can deal with it. Syphilis, for example, you need to have treatment for more than 3 months. Depending on the nature of the drugs you are using, you can continue treatment for up to 1 year before the treponema is destroyed completely, because it's a very, very strong pathogen. The pathogen that causes syphilis, treponema pallidum. So you must not do self-medication. You must be guided by a physician, a gynecologist, as the case may be, that will help you and make sure you take the appropriate antibiotics, you take it for the appropriate duration, and you take the appropriate dose, because dosage can vary, duration can vary, and the nature of the antibiotics can also vary.
Okay, at what point does it become very dangerous, or maybe leads to death or something?
Well,
anything like that?
You see, any of these organisms that that gets the blood involved, what we call septicemia. When there's a septicemic change, you know, in an infection that should be localized, then it becomes dangerous. Because when the blood is involved, the blood is pumped around the body. It can go to the brain, to the heart, to the lungs, you know, to the kidneys. So all these organs can become involved. And some of these bacterial diseases, they produce toxin. Like Staphylococcus can produce toxin that can be very dangerous, you know, at the level of the brain, and cause, you know, septic shock, you know, can lead to kidney failure. It can lead to heart failure. All these bacterial organisms can affect all these organs, these major organs, the brain, the heart, the kidneys. They are very, very vital organs. So treatment should be prompt, and it should be appropriate. And you should not try to self-medicate. Okay. That's my advice.
All right, you know that sometimes you'll be driving through Ring Road, you see these small vehicles calling out drug infection, this medicine. What are the dangers of patronizing such?
Yeah, I think it's not appropriate. That is something for the government of the Federal Republic of Nigeria to stop. You know, you have these people, you know, advertising these drugs and selling capsules along the street. So nobody knows the content of the capsule. What the powder in the capsule may not be bactericidal. It might just be glucose or starch, as the case may be. There were studies that were done many years ago when we were students in the early 80s. In the we just graduated. We're preparing for our postgraduate training. We had to do some studies to determine the potency of these various antibiotics. That time it was ampicillin and tetracycline. You just see this, I don't want to mention the tribe that used to do it, you know, they sell it along the road, around Ring Road, you just buy. So we bought and we analyzed it. We found that 99% of the cases, it was just starch, and some of them contains glucose. So they were not therapeutic at all. They have no therapeutic effect on the organs, on the organisms, and yet they were being sold.
But as
so the government, the NAFDAC, you know, they did their best. During the time of Dora Akunyili, I praised her when she was alive, and I still praise her in her death. She was just a wonderful woman. She eradicated this thing, and I think people believe that she lost her life. You know, what happened to her, we have all the details, due to her, you know, the seriousness she handled all these cases, because she didn't take bribe as much as they worried her to obtain bribe. So that
she did a good job.
A perfect job. She was that kind of Nigerian we should all emulate. You know, she did her job so well. She removed all the fake drugs from her street. Now the fake drugs are back, and there's nobody who cares. And our people, the fake drugs kill more people.
I'm sure the government are doing a lot. So if you say nobody cares, that's not
well,
that's
I'm
not
sorry.
True.
I'm generalizing.
Okay.
No, well, this is not, I'm not talking about Edo State. It's a Federal Republic of Nigeria thing. If you go to Lagos, you know, even before you go into the airport.
So all of these drugs, they do damage.
Yes. Normally, you find out that they are inappropriate, the content is unknown, and there are variable contents which are not good. So
a man's best bet is to go to the hospital.
Go to the hospital where you know that their supply of drugs is through a proper channel, and you are sure of the medicine you are taking. People die from buying drugs from the chemist. When the chemist man buys from a town, I don't want to mention, because it's cheap, and sell. And these drugs have no potency whatsoever. So when you are a hypertensive person, you are taking an antihypertensive drug, you believe that the drug you are taking is appropriate. When the content is not therapeutic, it's of no use. So the person dies, ends up with a heart attack because the hypertension is not controlled. So the person has died, not because he didn't take care of himself, it's because of the system failure, where people sell all these fake drugs. Fake drugs are just as dangerous. They are worse. Those who peddle with these fake drugs, they are worse than armed robbers.
All right, our lines are still open, 052290573. Call Dr. Steve Obama and let him, help you out, okay? There is no point in dying in silence when there is somebody you can talk to. At least we're not going to see your face, all right? So just call in and help yourself. If you do not come out to talk about what is wrong with you, if you self-medicate, you may end up dying, all right? And people will still know what killed the man. So bring out your problem, let somebody talk to you and direct you right where you should go. It's our social responsibility, and we're trying to discharge it to the best of our ability. 052290573. Give us a call, and please, if you reduce the audio level on your television set, it makes it easier. If you walk away from where your TV is, it makes it easier. Hello, caller.
Good afternoon.
Good afternoon. Please tell us your name and ask your question.
My name is Mr. Stanley. I'm a lab technician.
Okay, go ahead. Okay.
Please, I have sickness. I was tested for Staphylococcus aureus for about 2 years ago.
Okay.
There was a prescribed drugs for me, which was ogomexin. I took the drugs completely, the dose. After that, I went back again for the same place again, and the infection was also present.
The infection was still present?
Yes, of course, madam.
Okay.
They wrote other drugs for me that was also sensitive again. I took the same dose again. I went back, the infection was not there. There was about a year later, I was feeling the same signs and symptoms that I was feeling long ago before I went for the test. I just came back again now. I ran the same test. The infection was also there. I'm confused. I don't really know what to do. I need advice from the doctor.
Okay, don't be confused. The doctor will help you out. All right, Dr. Steve, you
okay.
got what he said.
Yes. Well, unfortunately, you've been treated on 2 occasions, and the infection seems to persist. Number one, you went to see somebody who gave you antibiotics. The question is, did they determine the nature of the pathogen? Did they culture it? Did they take a sample and culture it? Did they determine the sensitivity of that microorganism to the tablets that were prescribed for you? And number 2, what's the source of the tablets? Is it just tablets you purchased from a chemist, which we don't know the potency? What was the duration you used the tablets or capsules for? All these will determine whether or not the infection is eradicated. But if you still have the infection, we will advise you to see a gynecologist or a physician so that they can take samples from you and culture it and determine the appropriate antibiotics and treat you.
The samples must be cultured.
Yes, and treat you with the sensitivity report for appropriate duration. There's no need to self-medicate, and there's no need to keep buying medicine across the counter, because you are wasting your money and you are not getting cured. That's what you just proven. You just proven beyond reasonable doubt everything I have said during this discussion. Don't try to self-medicate. Make sure that you go to someone who knows exactly what the problem is, who can solve it in the appropriate way. Take a sample, send it to the lab, culture it, get the result, get the appropriate antibiotics, and use it for the appropriate duration. and I'm very, very convinced he will be well.
Okay, so he needs to like change hospital. Hello, caller. Good afternoon. Yeah, how you doing? Tell us your name.
My name is Angel.
All right, Angel. What's your question?
I like your glasses.
You what?
I like your glasses.
Glasses.
Yes.
Okay. We are not talking glasses today, Angel. All right. 0522905573. Please ask questions based on the topic we're talking about today. We're looking at infectious diseases that may hinder a man from procreating. It's not all the time that...
Hello? Hello?
Good afternoon.
Good afternoon.
Okay. Please tell us your name and ask your question.
I'm Faith.
All right, Faith.
Now, please, what causes weak erection?
What causes weak erection?
Yeah.
Okay. I'm sure she's asking a question for somebody.
Yes.
All right, Faith, get your answer now.
Okay. A lot of, there are possible causes. For example, injury to the spinal cord, brain injury, you know, it can just be psychological. Weak erection can be pathological, it can be situational. In which case, where with one woman there is an erection, with another woman there is no erection. You know, it has to do with the psychological effect of somebody trying to have a relationship outside a marriage, you know, or have a relationship that is not discreet, that is secret. So these are the causes of weak erection. It can be at the level of the spinal cord. It can be at the level of the lumbar vertebrae. The nerves that control the area, you know, may be damaged as a result of road traffic accident, and that can lead to weak erection. Somebody may have had a stroke, can lead to weak erection. Serious diabetes, that is poorly controlled diabetes, you know, diabetes mellitus, especially all adult onset diabetes, can lead to weak erection. In fact, that's one of the commonest reasons why our diabetic male come to the clinic. Is when they observe that they can no longer be as strong as they used to be when they were younger or earlier in their life. So that's why they come. And when you do tests, you find out that they are diabetic. So diabetes can deal with the nerves, just like road traffic accident can deal with the nerve. Cord transection at whatever level, at spinal level, the lumbar or thoracic level, all this can predispose to penile, you know, this erection, as I will call it.
Then is it treatable?
Yeah, it's treatable.
Okay.
Another possible cause is heart. When you have myocardial infection and there is paralysis or there is an infarct in the brain and one part of it is paralyzed, so it might affect the nerves going to that area, you know, to the genital area, and there is paralysis. So there are many causes. It depends on what the cause may be in this particular patient, and the individual has to be assessed thoroughly to exclude all these possible causes and determine what the cause is and try to manage it. But in addition, I just mentioned psychological causes. When there is no serious pathology, it's just a neurological, just an individual psychological inability to have an erection at a particular time as a result of fear or fright, as the case may be. So all this can be managed through psychosexual counseling.
Okay, and then good results will be
achieved.
Yeah,
they get good results, yes.
All right, Faith, hope you got your answer. Hello, caller, good afternoon. Hello? Hello? Kindly reduce the audio level on your TV. Hello? Hello? Hello, caller. All right, while we're waiting for more calls, doctor, let's look at preventive measures.
Okay. Yeah, prevention, they say.
Hello, good afternoon.
Good afternoon, ma'am. Good afternoon, ma'am.
Please tell us your name.
Your name is Hilda.
Okay. Go ahead with your question. Hello? Okay. You just want us to say your name on the program. That's good. Okay, 0522905573. Please call in to ask question. What we're doing here is very serious, okay? A question you ask may just save somebody's marriage or relationship. Hello, good afternoon.
Good afternoon.
Please tell us your name.
My name is Michael.
Okay, go ahead, Michael, with a question.
Where will I get this doctor?
Okay, just hold on to the end of the program, okay? I'll let you know.
Give me the address.
I did say that is CMD Gable End Specialist Hospital. Okay, Michael. In Benin City here, Michael. So stay to the end of the program, okay? 0522905573 is the number to call. Doctor, let's talk about preventive. Hello, caller.
Yeah, hello, good afternoon.
Good afternoon. Please tell us your name and ask your question.
My name is Victor Apeji.
All right, go ahead, Victor.
Yeah, I'm just calling you as a follow-up to the question that the doctor just answered.
Okay.
And when somebody asked a question concerning the causes of weak erection.
Okay.
Yeah, and I think the answer the doctor gave to suggest that
can you speak up a bit, please?
Hello, can you hear me?
I can hear you now. What's the question?
Yeah, I heard someone ask the doctor what is the cause of weak erection.
Yes.
And I think the response from the doctor seemed to suggest that it is due to medical predicaments.
Medical and psychological. Hello, Michael.
Can I just answer?
Oh, okay, yeah.
Yeah, well, just like you just mentioned, Michael, weak erection can be a psychological problem, definitely. It can be medical because I associated diabetes mellitus to it. It is a known cause of weak erection. It can also be surgical. For example, after a road traffic accident, there is spinal cord section, and that can result in a weak erection and can result in bladder paralysis where the person becomes incontinent. All these, you might call them medical problem, but they were originated from a surgical assault after a road traffic accident. I also mentioned that whenever you have an infarct in the brain, a part of the body, a part of the brain may be paralyzed, and the nerves going to that area, the genital area, may be affected, and that may result in weak erection. So all these are possible causes. I mentioned situational, erectile dysfunction because of what goes on in the mind. When you are having an affair, it might just not work out. But when you are with your spouse, then everything goes honky-dory. So that has to do with your psychological makeup. The fear of trying to do something outside your matrimonial home can result in a weak erection. That's the way God has made it. You can't change it.
Okay.
Okay.
All right. Somebody sent a text to say that as a follow-up, what could be the problem for constant or persistent erection?
Well, persistent erection, that's priapism. It's a medical problem. In fact, it's an emergency. It's very common in this part of the world because we carry the sickle cell gene. Most of these men that have hemoglobin excess, because of the sickle nature of the cells, they can block the blood vessel. So blood, during the process of erection, blood moves into the cavernous spongy muscles, and to make it turgid, it's just blood. And during tumescence, the valves are open, the blood moves back to the general circulation. But in sickle cell patients, because the cells are sickle, they form infarct that blocks that valve, the return valve. So the blood goes in, but it does not come back. So it keeps the penis erected, and it causes a lot of pain for the individual. So sometimes when it cannot be treated, it's a cause of penile amputation. But usually, you give a lot of fluids, normal saline to flush it, put the person under pressure, give something to take away the pain, and the individual gets better, in most cases. In 80% of cases, yeah, they get well, they go back to their normal life. Treatment is just to give a strong analgesia parenterally, then you give fluids at the same time. Not blood, just plain fluids to help remove the blockage. It's just the sickle nature. But although it's commoner in sickle cell patients, it can also occur in non-sickle cells patients. Yes.
All right, Doc, let's quickly talk about preventive measures before we wrap it on the program today.
Yeah, prevention of any sexually transmittable disease is to know who you are having relationship with, that the patient, the individual is clean. Number two, if you are not sure, is to use a protective measure. There is the male condom and the female shield, the fem shield, which is quite common. For a female, you quickly, slip it into the vagina, because it's a spring. Once it's placed, it's folded and placed in the vagina, it opens up. So it prevents you from getting pregnancy, semen, and getting infection. It's protective against major pathogens, including the HIV virus. So it's good to use the fem shield in the case of the female, and to use the condom in the case of the male. These are very protective. And if you are aware you are a carrier of any of these pathogens we have mentioned today, please, please, please don't try to spread it by giving it to unsuspecting female friend, because it's not fair. Whatever we do, we will get the repercussion. So let us do what is right all the time. If you have a disease, don't knowingly pass it to somebody else, because in some places it's regarded as a very serious criminal act, for which somebody can go to jail for many years. So don't do it. If you have a disease, go and see your doctor, and you'll be treated and you get well. And if you must do it when you have a disease, please use protective shields.
Okay.
Thank you.
All right. Thank you very much, Dr. Steve Ogboma, for finding time to be with us on the program. I did say that I was going to talk to a young man to do a follow-up on this topic, for those of you who have been trying to call and couldn't reach us, and for those who are very shy and don't want their voices heard on air, you can quickly call this number 070-550-71439, 070-550-71439, or better still, you call 090-944-8923. All right, those are the numbers to call to reach us on as a follow-up on this topic. We'll definitely bring you another topic again on Monday. If you have anything that will harm the other person, I think you should keep it to yourself and then see a doctor. All right, then when you are cured, you can, of course, do everything. But above all, learn to be protective of you and the next person. We'll see you again. Thank you, Dr. Steve.
Thank you very much.
Okay, bye-bye.
Bye-bye.